Good day and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabert-Schuster, State Director of AARP in the Territory, and as always, it's a pleasure being with you to bring you very important information to help you to choose how you live as you age. Studies have shown that most people say they want to be in control of their own health care. Yet many Americans have no plan in place should they become too ill or injured to make decisions for themselves. AARP is particularly concerned with Americans choosing the way they want to live as they age. Today, we have invited Tracy Sanders of Continuum Care Hospice to discuss the importance of advanced care planning to living well. And so, Tracy, welcome to our show.
Thank you for having me, Troy.
A pleasure. It's always a wonderful experience speaking with you about issues of aging and about planning, advanced care directives, and so forth. You and I have worked together for a long time, even before I came to AARP, and we continue to work together now that I'm the state director of AARP. So, again, thanks for being on our show today.
My pleasure.
And so we are looking toward these workshops that we have planned with you regarding advanced directives. But before we get into that, to better understand advanced care planning, can you define and describe advanced healthcare planning and why it is needed?
Thank you. It is very important, as you said, to be planning what we want, decisions we want to make during different times of our life. And really, when we talk about it, it's really talking about choices. It's talking with our loved ones, talking with our physicians. And there's really two documents. One is a living will that you actually write down your own directives and what you would like, or a healthcare power of attorney that you identify another person to act in your behalf if you're not able to make decisions for yourself. But both documents should reflect what are you thinking of, what do you want as far as your own body when you're not able to make decisions for yourself.
Okay, so advanced directives then has two components, or it can have two, or it can have one of these two. Am I correct in saying that the two parts are living will and healthcare power of attorney?
They're actually two separate documents. One you write yourself. It would be something like, I, Tracy Sanders, this is what I want, A, B, C, D, and you sign it. It doesn't leave room for negotiation, and it's a document you have and you share. Having a healthcare power of attorney is when you identify a proxy that will help you identify and exercise your end-of-life wishes, or if you were in a persistent vegetative state, or as we often refer to, unable to make your own healthcare decisions.
So can an individual have both of these documents in place, a living will and a healthcare power of attorney, or is it customary just to have one?
It's customary to have one. A living will is really a closed document that you write and you sign. It doesn't leave room for interpretation. But when you have a healthcare directive and you have a healthcare proxy that you've been able to explain, these are my wishes, this is what I want, this are my values, my priorities, then they're able to act in your behalf.
Okay, okay. Because I know some people who have both documents in place and some people only have one. So I was just trying to come to an understanding as to what the preference is, or what the best solution is to this dilemma of end of life planning. So either one is sufficient, rather than needing to have both of them.
Mm-hmm. Yes.
And so what are the steps involved in advanced care planning?
With advanced care planning, it really takes time to be thinking about what are your priorities, what are your values, priorities, what's the meaning of your life, how do you measure and define the quality of one's life. Everyone's going to have very different ideas about what they want or they don't want if they're not able to make their own decisions. And of course, we're talking about different scenarios. We oftentimes think of advanced care planning at just end of life or a terminal disease, but it's also if you're not able to make decisions for yourself. It could be something that's temporary. That you've had an accident, you're on a ventilator, you can't speak for yourself, and you want to know that people are supporting what your wishes are, the values that you have towards life, and what you want to be able to speak to. That's why we spend a lot of time also identifying who should be a healthcare proxy, identifying somebody that could speak on your behalf. They know what your values, your priorities are, and also to be able to communicate these thoughts and feelings and wishes to our medical community, physicians, nurses, healthcare providers. So if they're making decisions about what you are or not going to have in a medical arena, your wishes are there and they're respected.
And it's so very important for individuals to have this in place. I'm thinking back to 2 different hospitals in which I served on the medical ethics committee.
Mm-hmm.
And oftentimes we were confronted with cases where somebody was terminally ill or on life support, and their next of kin could not come to an agreement as to how to proceed. They didn't have any advance directives in place. There was no living will. There was no healthcare power of attorney. And it was dragging out the battle between the next of kin. And then it ended up falling to the ethics committee to make decisions about people's end of life. And that was a very difficult place for all of us to be, especially when we consider that we didn't really know the person, we didn't know their family, we couldn't take into consideration what the person wanted because we never were able to have a conversation with the person who was sick and suffering. And we just had to go on the sheer science and make a decision about somebody's end of life. And it's a heavy burden to be on such a committee, a really, really, really heavy burden to make a decision about somebody's end of life. So from my perspective, having been on these committees and having been put in a position where I've had to make these decisions along with a committee of healthcare providers, I really encourage people to make sure that you have a living will in place or a healthcare power of attorney so that your decisions can be followed rather than hospital committee or in some cases even the Department of Human Services making a decision about your end of life. I'm sure you've seen this quite often.
No, I think what you're stating is very, very important. When you ask someone else to make the decision, you are impersonalizing it because they're trying to imagine if they were in your position. So this is why it's important when you choose a proxy. And, we talk about a proxy that not only will fulfill your wishes and end of life wishes, but also to be able to advocate for you for a physician or a healthcare entity that may be adverse to what decision you might have. A big part of what we do with Advance Directives is getting personal preferences. So you really look at what does life mean for you. We talk to our elders sometimes and they'll say, oh, I've had a good life. I know you're going to make the right decisions for me. That's a wonderful opportunity to say, let's describe what that looks like. I've had a good life, but I don't want to be on life support. Or I've had a good life, put me on life support to see if that will help. And it really helps enable those loved ones making the decisions, whether it's for your mother, your father, your spouse, family, or a good friend, to be able to say, this is what I know they would have wanted. In the light of some of those difficult times. And the one thing I talk about healthcare planning, we will spend more time planning a 2-week vacation than the most important journey of our life. And so it does take thoughtful planning. And I always say there's no right way or wrong way to start the conversation. And it's really looking at going through. So for example, the workshop we're planning is to say, all right, let's take these apart. Let's define the terms. What kind of information do you need to make an informed decision? We have to describe the definitions. Many of us in healthcare, we have alphabet soup, we have acronyms, we use all these terms, but we have to reduce it to a level that someone can understand and say, yes, I understand. When you say CPR, they might think of a TV show, cardiopulmonary resuscitation, but what does it truly mean? When you talk about a ventilator, we talk about all of these things. So we have to reduce it to a common element that people can easily understand, and put it in the language, so we're able to communicate, to agree on what we're going to do and what decision we're going to make. As you said, when it resorts to an ethics committee, it's impersonal. And oftentimes you have someone making a decision that the family may or may not agree with. So it's putting the power back in the family unit to the patient, their loved ones, and those that are involved in their care.
Exactly. I like what you say about the most important journey.
Mm-hmm.
And it is a journey. Sometimes people think of death as just being a finality, but it is a journey from this life into the next life. However you view it, whatever your religious beliefs may be, whether you're Christian or Muslim or Jew, or some other religion or some other philosophy, it's a journey, and we do need to be aware of that. We're all going to face that journey one day. I think that a lot of people don't want to engage in making those plans because they don't want to think about that journey,
Mm-hmm.
right? It's a very hard thing for some people to swallow. They want to feel that they are immortal, that they're going to be here forever, or that they don't want to leave their loved ones. But it is what it is, huh? I mean, we're all going to make that journey someday, and we do need to plan. We do need to be prepared for that, with these kinds of advanced directives, and emotionally and spiritually prepared. Without giving any kind of sermon, but again, whatever your religious belief may be, whatever your philosophy of life may be, to really be prepared for that. And so, in your practice at Continuum Care, how do you help people? How do you engage in that conversation with individuals and with families about developing advanced directives?
Mm-hmm. We start with very much the same way that we will be presenting at the workshop. You really have to look in and say, have you thought about this? Have you had a discussion? Do you have any end of life wishes? Let's evaluate how you feel about life and living and dying. What are your spiritual thoughts? What are your philosophies of living? And I think the common situation we run into, not only in hospice, but you hear it all the time. And even being a nurse with my own mother, she said, Tracy, you'll make the right decision. They want to push it off on someone else. But it's a matter of saying, I care about you so much. Let's together make a decision, because it takes the burden off the decision makers, the loved ones, the family, to be able to say, Mom, what is it that you want? Dad, what is it you want? Or your loved one, and to walk through. As I said, there's no right way and wrong way to start the discussion. And you'd be surprised, once you start the conversation, individuals will engage. But many of us, we have the gift of avoidance. Let's do it tomorrow. Let's do it another time. And unless you sit down and say, this is so important, it's so important that what you want, I want for you. And I don't want to be in a crisis situation where I'm nervous, I'm anxious, I want to make sure I'm making all the right decisions, where we know when you're stressed, the first thing we're thinking of is, I'm not thinking straight. So how can we sit down with our loved ones, siblings, extended family, so we're able to make this discussion? And it should be done every few years. We're not talking about end of life, but we're talking an advanced directive should be done when we're younger. What happens to us at 20 or 30 or 40, major life events can happen. We can go through a divorce. We can go through a remarriage. We can go through a terminal illness, a progressive illness, loss of a loved one. So all of these things that happen change our attitudes and to be able to make those decisions. You just don't write it, set it, and forget it. It's times you have to go back and revisit it. And so that's really what's very important about this. It is the conversation. It is dynamic. It's ever changing. And it's only as good as, yes, the piece of paper that it's written on, but what's more important is how do we communicate that to our loved ones? You just don't write an advance directive and put it under your pillow or put it in the safe deposit box. It should be where those that have to make the decision have it readily available to your physician, to your faith leader, copy in your home, those siblings. And when you make a change to your advance directive, know who do you have to go back and give a revised copy to and explain why you're making these changes in the decision. One of the other things we also find, many get confused with an advance directive with a will of assets. What am I going to do with my physical property? This is separate and apart from that. This really has to do with health care directives that we're able to give the healthcare providers, whether it's in the hospital, a nursing home, a home health care, or a hospice, an assisted living facility, so they know what our wishes are when something happens to us.
And so many people wonder if they're making the right decision as to who they choose as their healthcare proxy. Are you ever faced with those questions, confronted with those questions from patients you serve? And what advice do you give to individuals as to how they select or who they select to make sure they're making the right selection as a healthcare proxy?
As we say, that's an excellent question, Troy, because it could be that I am creating a healthcare directive for my husband, but it is going to be hard for me to institute an advance directive. And I'm just saying that as an example, a husband and wife or any couple or any partnership. It might be that you say, I care so much about this person that I love. I would like to have another person be the healthcare proxy, because if I'm going through a crisis, I'm so involved in the care that I'm providing for my loved one that I'd like someone else that knows me and my partner to help us remind what the other person wanted. Because sometimes this is filled with guilt. Did I make the right decision? And should I change my mind? But when you have someone to say, this is what your partner wanted, this is what your loved one wanted, it helps you to be able to sit back and say, yes, I'm respecting their wishes, so that you're able to stay focused at the matter at hand. So the healthcare proxy is very, very important. And in the workshop, we'll talk who should be a proxy, who should not be a proxy. You don't want a proxy generally to be a child. You generally don't want a proxy to be your healthcare provider. You don't want a conflict of interest. You want someone that can really understand what your wishes are and to be able to be the advocate for what you wanted when the time comes.
And we've mentioned this workshop several times. And so for our listening and viewing audience, AARP in the Virgin Islands is hosting an Advanced Directives workshop. It'll be on Thursday, August 25th from 5:30 in the evening until, I guess, about 7 o'clock until we end, about an hour and a half. It may even go a little bit over, but starting at 5:30 p.m. We're running the information on the ticker across the bottom of your screen as to where you can go to register for this Advanced Directives workshop. Tracy Sanders of Continuum Care, who's speaking with me today, will be conducting that workshop. And you can also visit the AARP Virgin Islands Facebook page to find the information there to register for the workshop. You can just click on it on Facebook and go directly to it, or you can follow the directions going across the ticker at the bottom of your screen. The workshop is free of charge to all people. So please do register for this wonderful free workshop and learn so much more about advanced directives. And also, we want the public to be aware that AARP is in the process of advocating for an advanced directives registry here in the Virgin Islands. And that's really, really, really important because sometimes people do have advanced directives and the healthcare proxy or the healthcare provider or the hospital doesn't know about it.
Mhm.
So once we have this advocacy completed and it becomes law and the registry is developed, you can simply enter your advanced directives in the registry so that the hospitals or your healthcare providers or your family, your loved ones can access it and make sure that your wishes are followed. Also, another thing that AARP in the Virgin Islands is advocating for is our own territorial
Absolutely.
advanced directives forms.
Mhm.
Right now, we don't have official forms in the Virgin Islands. We've been using forms from different states or even just generic forms. So we're in the process of advocating for advanced directives forms customized for the Virgin Islands. And so Tracy, tell us your thoughts on the registry, the Advanced Directives Registry, and the customized form for the Virgin Islands.
I think it is very important. Any of us that go onto the internet and we look for an advance directive, the first thing that they say is click your state. So you'll see it in Kansas and California, New York, and there's nothing for the Virgin Islands. So I think it's something that's very, very important. I'm a strong advocate for adopting a single document for the Virgin Islands. So we are all reflective of what we want to have in this document for our community. Looking forward to having it in English and Spanish so that we are able to meet the needs of our entire community. I think it's very, very important. And I think having the registry, because we know when you go to the hospital or go to the doctor's office, it's like saying, where is it? Oh, I left it at home. I don't have it. And trying to get that document at a critical time will save time and money when you need to have the document. And also to underscore to Troy, at the workshop, our esteemed attorney, Royette Russell, will also be presenting so that you'll really hear the legal side of advanced directives and many questions that individuals have. I represent the healthcare and that part, but Attorney Russell will be presenting those issues that many of us have about the legality and the legal considerations that we have to have with an advanced directive.
That's right. I was so pleased and happy to have Attorney Royette Russell taking part in this workshop as a presenter. Very fine, well-respected attorney here in the Virgin Islands, and for several years she was the chief legal counsel of the Governor Wong F. Louis Hospital and Medical Center. So she's seen many, many cases where the advanced directives were not available or there were no advanced directives at all. And seeing those very difficult decisions being made on behalf of the person who was sick and suffering. So we're really happy to have Attorney Royette Russell joining you, Tracy Sanders, in this wonderful advanced directive workshop that is coming up on August 25th, Thursday, August 25th at 5:30 p.m. And again, we're running the ticker across the bottom of the viewing screen. So you can go to our AARP.C events website or call the number 877-926-8300. And also one of the easiest ways to register is by going to AARP Virgin Islands Facebook page and simply clicking on the post where we advertise the workshop, and it'll take you right into CVent so you can register for this very important workshop. And we're looking forward to it. So Tracy, any final thoughts? We have about 3-4 minutes left, and how can people find more information on advanced directives? How can people get in contact with your office, perhaps for some more help? What information would you like the people to have?
Sure. I think one of the closing thoughts I do want to share with the viewing and listening audience is, although it can be a painstaking process to go through, there's nothing more fulfilling that when you've advocated for somebody you love and you make that decision and you realize it's something that that individual participated in, it takes a lot of the burden off of you. And that's something that, as we say, is really priceless when you're talking about a crisis situation. For us, we have an advanced directive in English and Spanish. It is on our website, which is www.ccivi.com. You're welcome to call either our St. Croix office or our St. Thomas office. Let us know what your email address is, or come by and pick up a document. Again, we have it in English and Spanish. And we also have some of the supporting documents that help you explore personal preferences, what needs to be included or thought about to have a proxy, a definition of the terms, and some sample language. Sometimes it's like you just don't know where to start. So I would really, again, underscore participation in the workshop. And if you missed the workshop, please give us a call at Continuum Care. As I've shared, I've been an advocate for advanced directives. We're very willing and able to sit down with individuals or small groups or larger groups to put a workshop so that individuals can fill it out.
Wonderful. And I'm here looking at some of the questions coming in through Facebook. And one of the questions that just popped up is, who should attend these workshops? Again, these workshops are free of charge to any and everybody who wants to participate. At AARP, yes, we do focus on the 50 year of age and older population, but these workshops are open to people of any age over the age of 18. So even if you're 18 and you're the caregiver for a parent or for a grandparent, please do register, come and learn, and go home and talk to your parents about it, talk to your grandparents about it. It's open to everybody, regardless of age. But please do come and participate before you are in need of an advanced directive, because then it's probably a bit too late, right? So for every and anybody, and you're never too young to have advanced directives. You're never too young. You know, you could be 5 years old and have advanced directives. In that case, it'll be your parents, really. But you could be 18 years of age or older than that, and have advanced directives, because we never know when we may fall ill or be involved in some kind of terrible accident, and somebody has to make the decisions for us. So again, these workshops are free of charge. Please visit our Facebook page at AARP Virgin Islands and register for them. The registration is filling up quickly, but we're doing it virtually, so we can accommodate a large number of people. And please do come and learn to prepare yourself and to prepare your older loved ones for when decisions need to be made, because it is a journey that we will each have to embark upon. Mm-hmm. So, Tracy, thanks so much for being with us today and bringing this important information to us. And we look forward to having you and Attorney Royette Russell conducting this workshop that AARP will be hosting. And we look forward to everybody in the Virgin Islands learning so much more about advanced directives and making decisions for their own life. So thanks again, Tracy.
Thank you, Troy. Thank you.
Have a great day.